Hello everyone, my name is Shad Reyes and this is Heart Trending. In this video, I'm going to go and summarize the up and coming TCT 2020 meeting that's going to be taking place tomorrow. And it's going to have a lot of late breaking trials and live cases that I'm going to try to highlight for you in preparation for tomorrow. So stay tuned. Um, this is Shad Reyes and this is Heart Trending. So again, TCT is going to be taking place tomorrow. It's going to have a lot of activities, live cases, and later breakers that I think majority of the interventional cardiology community has been waiting for, either related to interventional cardiology or structural heart meetings. So let's dive deep into tomorrow and see what's going to be taking place. So starting from tomorrow at 8:35, it's going to be an introduction and opening remarks, and then at starting the meeting with a chip case around 9 o'clock Eastern time. It's going to take almost 1 hour and 5 minutes. This time going to be from University of Columbia, and the live case discussant, our moderator will be Dr. Greg Stone and Antonio Colombo, and the primary operator is going to be AJ Courtney with Jeff Moses and Akiko Mahira. So the case is going to be coronary physiology, calcification, imaging. So it's going to be a very great case in preparation for and as an opening for the meeting. Following that, it's going to be a later break in trials, and I think this is going to be a very impactful session and sponsored by Jack Journals, starting at 11 o'clock a.m. Eastern Time. And the moderator will be Dr. Valentin Fuster and Renaud Vermani. The first trial and the third trial as well, they are kind of complementing each other. So the first one is Prospect 2. It's a prospective natural history study using nurse IVUS imaging in patient with acute myocardial infarction. This is looking at the vulnerable plaque. And in terms of how we evaluate or how we treat these, it's going to be a follow-up study, which is a Prospect Absorb trial, which is a randomized trial of interventional treatment of vulnerable plaque. Presented by Dr. Greg Stone. So let me show you a couple of slides about Prospect 2. So again, as I mentioned, this is a natural history observational study using multimodality imaging that will examine the natural history of a plaque, especially in patients presenting with stable and unstable angina, and establish the utility of how we can use this imaging modality to triage care for these patients. These patients who have a vulnerable plaque based on imaging will be randomized into Prospect Absorb study. And please pay attention to the detail of the study because it's very interesting. So the study main purpose is to examine whether treatment of vulnerable plaque with the Absorb BVS plus guideline medical therapy safely increase the MLA at 24 months compared with a guideline medical therapy alone. Excuse me. These are patients who had angiographic stenosis that is less than 70% and yet has a negative, again, negative FFR and IFR or IFR, and they have a lot of features on imaging that shows this is a vulnerable plaque, especially with IVUS showing a burden for at least more than 65% in one of the frames. This is very interesting randomization, very interesting study, but it's going to answer a lot of the questions that we see on daily basis in the lab. Staying in with physiology and imaging, there is a combined OCT morphologic and FFR hemodynamic assessment of non-culprit lesions and in patient with diabetes. Again, to summarize it, from what I read in preparation for this live broadcast, is these are patients who are diabetic, who had an unstable angina or stable angina, referred to the lab and had a negative FFR. So physiologically they are negative. However, when these patients will undergo OCT, if they have a thin cap fibroatheroma or thick FUD, then they will undergo stenting, even with negative FFR. And the follow-up is 12 months. So, but if they have a negative TICFA, then for the patient will not undergo any PCI. This is that conclude the first session of the late breakers. The second session will be starting at 12:30 p.m. Eastern Time. And this time will be a session co-sponsored by the Circulation Journal. The moderators will be Dr. Roxana Miran and Dr. Sunil Rao. The first presentation is going to be NACME. This is a very interesting and very important registry that was started by Dr. Tim Henry and the group at Minneapolis Heart Institute, Christ Hospital, and we are delighted at DMC to be part of it as well, which is the outcome from the North American COVID-19 STEMI registry presented by Dr. Tim Henry. Let me tell you a little bit about it. So this is where all patients presented during COVID pandemic into the cath lab with STEMI. These patients had a elevation myocardial infarction, and they either triaged for medical therapy or angiography or and stenting or cabbage and what kind of medication they received. So this is will answer a lot of questions, especially now in the cath lab. We continue to see COVID positive patients, and we know that COVID-19 is a thrombogenic infection. Therefore, this registry will answer a lot of questions. The second important late bracket trial on the second session that's sponsored by Circulation is Compare Crush. This is a study based in Netherlands, and it's a randomizing patient to crushed compared to non-crushed prasugrel pre-hospitalization for patient presented with STEMI. So these patients are randomized in the emergency truck, in the EMS truck before reaching the hospital. And it's an interesting study to look at, especially with the prasugrel being the agent. TICO-STEMI is a follow-up, I think, study. I couldn't really read a lot about it, but I think this is a follow-up study. The initial 1 year was presented at ACC 2020. The main purpose or the outcome is to compare monotherapy with antiplatelet agent ticagrelor compared to dual antiplatelet therapy beyond 3 months of that for patients presenting with acute coronary syndrome. The 1 year follow-up study presented again at ACC, and now we're going to see the follow-up going to be presented at TCT 2020. Then we'll have a break, and then at 2 o'clock Eastern Time, we'll start a very important session is interventional cardiology in the era of COVID-19, moderated by Dr. Tim Henry and Sahil Parekh. This is, and a discussion will be Dr. Fuster, Mamas, and Renu Vermani. As you see, the list of topics here is very related to COVID-19 in the cath lab, thrombotic complication of COVID-19, how to microthrombi a cause of cardiac injury, and then very interestingly, an OCT assessment for microvascular lung thrombosis in COVID-19, and also robotic assisted PCI as a strategy to reduce risk of intra-procedure contamination by COVID-19 patient. A very interesting study, and also another structural study. After that, we'll have a study related at 4 o'clock. We'll have a back to life cases. This time going to be from Quebec Heart and Lung Institute. And the live case moderator will be Dr. Martin Leon, and the co-moderator will be Robert Bono. And the live case will be again from Canada, and will be about TAVR Sapien 3 Ultra for AS with a small annulus. That will be followed by another live case from Columbia University of TAVR Evolute Pro for critical AS with a heavily calcified valve and LVOT. Again, LVOT, calcification and risk of bundle or rupture. Again, self-expanding compared to balloon expandable. It's always been a discussion during our heart team approach for these patients undergoing TAVR, and then the risk for pacemaker and so forth. So very important study. The operator for the Columbia case will be Sushil Kurali and Tamim Nazif and Rebecca Hahn and Isaac George. I think with that, I think that will summarize all the studies. As you know, there will be a lot of a busy day tomorrow, but I like the way that TCT put it this year. They have spaced out the session throughout the day. So if you have to do a procedure, you have a clinic or something, you still have the opportunity to catch up. Again, these have also on-demand access. And also TCT MD always do a wonderful job in terms of coverage. So stay tuned. This is a great day tomorrow, busy day. And I hope to, and as I said, I'll try to summarize things for you at the end of the day tomorrow, as they are getting published simultaneously in the journals. With that, thank you so much for your attention, and till tomorrow, have a nice evening and good night.